In this training session, we're going to cover the steps to reporting into the National Healthcare Safety Network's application, also known as NHSN. Before we get started, we want to go over a few protocols to help you identify which CDI lab ID events to report and which ones not to report. Do not report lab results into NHSN that were collected prior to the resident's admission to the nursing home. We suggest keeping a log of positive CDI lab results to keep track of duplicate test results to avoid reporting those that are considered duplicates. We will talk more about duplicates in just a minute. All identified CDI lab ID events must be entered into NHSN using the specific location where the resident was assigned at the time of specimen collection. It allows facilities to keep track of where the infections are occurring in the facility, as well as monitor trends in individual units and facility-wide. Here's some reminders you may have already seen regarding reporting. There are 3 steps to CDI surveillance reporting: monthly reporting plan, event reporting if there are any events to report, and summary data report. We will go over these when we get to each of these steps, but I did want to point out that monthly reporting is due by the 15th day of each month for the previous month's data. A reminder will be sent out prior to the due date each month. Those who do not report by the 15th of each month will receive a follow-up reminder to do so. This page covers stool sample collection and reviews what labs look for to determine whether the sample shows positive CDI. Only loose stool samples should be tested and reported. Stool should conform to the shape of container. The most important identifiers to report are those that have a positive toxin result. Here's a table to hopefully help with visualization. The C. difficile infection is identified when the resident has a positive laboratory test for toxin A and or B. It can also be identified if there's a toxin-producing C. difficile organism detected by a stool culture. Do not report in NHSN if a lab report shows a positive antigen but a negative toxin. So here's where we're going to talk about duplicates. A duplicate is a C. difficile positive laboratory test from the same resident following a previous C. difficile positive test within the past 14 days while in the facility. If the CDI lab ID test was conducted longer than 14 days since the last test, the CDI lab ID event can be reported. If it's within the 14 days since the last test, then it's not reported as that's a duplicate. If it's past 14 days, it is not considered a duplicate, so it's fine to report. So we're going to look at the table here just to kind of give you a better idea about this. So in the first test that was done on 1/3/2016 is not considered a duplicate because that is the initial test that was reported into NHSN. The same patient had another test done on 1/9/2016. The reason why that is considered duplicate is because it has been within 14 days since the last test. So because it's not past 14 days, it's considered a duplicate. Same goes for 1/20. That is a duplicate from the 1/9. It's not the initial date, it's whatever the most recent test is. So in this case, 1/9/2016 was the most recent. So because that is within 14 days, then it is considered duplicate from the 1/9 to 1/20. Then we go down to 1/29. That is also duplicate for the same reason that it's not within 14. It's within 14 days from the 1/20. So that is considered a duplicate. And the very last one on 2/23/2016, that one is not considered a duplicate because it has been more than 14 days since the 1/29/2016 for the same patient. So hopefully this table helps to clarify or helps with understanding about the duplicates. So once you have determined that it's not a duplicate and you're planning to report, the next thing you need to do is determine whether it's an incident or recurrent CDI lab ID event. You will have to report this into the event report when you're reporting the event electronically in the NHSN system. So we want to kind of explain and go over so to help you understand the differences. So the incident is any CDI lab ID event from a specimen collected greater than 8 weeks after the most recent CDI lab ID event entered into NHSN, or the first lab ID event entered for the resident while in the facility. A recurrent is any lab ID event entered more than 2 weeks and less than 8 weeks after the most recent lab ID event reported for an individual resident in a facility. So as we go back, a duplicate is when if it's been within 2 weeks or 14 days from the last test that was conducted, so that does not get reported. Then there's recurrent, which is after 14 days or 2 weeks, but less than 8 weeks. That's a recurrent. If it's been more than 8 weeks since the last test, or it's the initial test where it hasn't been reported at all, then that's considered an incident. This org chart here is to help explain. So in this case, the C. difficile came back positive, and then the user had to determine whether it was duplicate or not. If it's a duplicate, do not report. And if it is not a duplicate, then you do report, and then you determine whether it's incident recurrent. And then you report once you determine that. So this is a little table to help with the definition between incident and current to help you hopefully understand. This is regarding the same resident. On the left side, you see the same resident ID with 1234. There's 2 different admission dates. There's 3/1/2015 and 5/10/2015. The middle column shows the date the specimen was collected. So the first one on the top, which is 3/1 current admission date, and the specimen collection date is 3/6. The reason why this is an incident is because it's the initial report. It wasn't reported prior to this, so this is the initial one. The second one for the same resident, same current admission date is 4/8. And because this is, it's within 8 weeks, it's considered a recurrent. It has been within 8 weeks since the last one, which was 3/6. So it's a recurrent. The patient left, they came back. They were gone for more than the 3 days, so they came back and now they have a new admission date. But because it's the same resident and the last specimen was collected on 4/8 and the new one is collected on 5/14, it still falls within the 8-week time frame because it's not looking at the admission date, it's looking at the specimen collection date, and it's the same patient, resident. So that's why it's considered a recurrent. The admission date doesn't really affect that. It's more of the date last specimen collected. And then the fourth line down, which specimen collection was 8/10, because it has been more than 8 weeks since the 5/14 specimen collection, it is considered an incident. And the very last one, same thing, is 11/21. It's been more than 8 weeks between 11/21 and 8/10, so it is also considered an incident. So after you entered in the event into the system, then the NHSN application will go further and determine whether it is a community onset or long-term care facility onset. Community onset, also known as CO, is the date specimen collected equal to or less than 3 calendar days after current admission to the facility. Long-term care, also known as LO or LO, lab ID event, is the date specimen collected for equal to or greater than 3 calendar days after current admission to the facility. And also, if it is considered a long-term care facility onset, the system will further determine whether it was an acute care transfer long-term care facility, which is also known as ACT-LO. By the way, these abbreviations will come in handy when it comes time to pull some reports, which we will review in a few months from this session, so you understand what the data looks like and how to pull it. And the system will know whether it's an acute care transfer long-term care facility onset or ACT-LO based on what you enter in. When you enter in the event report, there's a question that we'll get to in just a bit about determining whether it's yes or no if the patient came from an acute care setting. So this is kind of another table to show you for visual purposes the difference between community and long-term care. So if the patient was admitted, day 1 is June 4th. Day 1 is the first day that's counted for up to day 3. if you do run a specimen, collect a specimen within the first 3 days and it does come back positive, then it's determined community onset. If you run it anytime between day 4 and after, then and it comes back positive, then it's considered a long-term care facility onset. Okay, so now we're going to get started with reporting. And the first thing you will need to do is go to the main login page, which is https://sams.cdc.gov. And you will be taken to the home page. That's the top clip up here. And you'll see 3 different login portals, but the one you're going to select is SAM's grid card credentials because now you have your grid card. So you're going to select login, and then you will be taken to the login page, the first one I should say, which is logging in with your email address and then the password you created when you set up your SAM's card account. And then once you're successful at passing through that, then you will be directed to the SAM's grid card credentials login page. And you're going to log in with whatever credentials they're asking for, the letter and number, and you will just enter in based on those grids from your grid card, and it changes every time you log in. You will then log in, and then you'll be directed to the My Applications page. And when you get to the My Applications page, you're going to select NHSN Reporting. The next page depends on whether you are reporting for one or multiple facilities. So if you're reporting for multiple facilities, you will be directed straight to the home page, which we will see in just a minute. If you are reporting for more than one nursing facility, then you are going to see the drop down here. You're going to be to the landing pages where you're going to be directed to. You're going to select your facility in the drop down here. There will be multiple facilities listed there, and then you just select the appropriate one that you're reporting for, hit submit. Then you'll be directed to the home page, and then the home page will say home page on the top here, and it will have the blue menu on the left side and different categories to choose from. We're going to go over some of these categories for this session because they apply to reporting. So the first step to reporting is creating a monthly reporting plan. You cannot start your reporting unless you have a monthly reporting plan in place. You can create up to 12 months worth of the monthly reporting plan. We'll go over that on how to create copies. If you have 5 minutes to spare and you want to save yourself time in the future when it comes to reporting, or you can skip a step in the future, just, you can create all 12 of them just to get that out of the way. And so let's get started on that. So you select reporting plan, and then you go to add. And once you go to add, you're going to be directed to the add monthly reporting plan page. It looks like this on the top here, and the facility ID will be defaulted because you already selected that at the beginning, or if you're just associated with one facility, it already knows what facility. And then you're going to select the month and year that you're planning to report the data. And then you're going to be directed to this page here, which has 3 modules showing, but you're going to ignore the top, the HAI module and the prevention process because those do not apply to this project. Only the Lab ID event module will be the only module you're going to be completing on this page here. And what you complete is very standard. It's listed right here. You're going to select facility-wide inpatient under location, specific organism, C. difficile. And then you're going to check the box here just to verify that you are confirming that all specimens will be checked. And then once you do those 3 sections there, you just go in and save. And then you'll get a notice that your monthly reporting plan has been successfully saved. So as I mentioned, if you want to, you can either repeat the steps if you want to add all 12. You can repeat the steps that we just went through by going to add and just do the same thing. Or if you want to just copy from what's already existing, because to save yourself a little bit of time, just go to find, and then you're going to select the month and year that you want to copy and hit find. It will display it. And you're going to select copy from previous month. And when you do that, the system will know that you're trying to copy the following month now. And so you select that, and then you just hit save. And then your copy will be made for that month. So, and that's something you can just repeat the process to copy your monthly reporting plans. So in a case which is not that common, but it possibly could happen, there may be a month where your facility is unable to provide CDI surveillance, whatever reason, maybe the person is out on leave or they've left and there's nobody available to do CDI surveillance and report, then you will, instead of creating, when you do create the monthly reporting plan, you still have to provide the monthly reporting plan. You will just, instead of filling out all the section that we reviewed, you're going to select the month and year, and then you will select the box here. So there's no long-term care facility component modules followed this month. That just lets the system know that there's no could be any other data you're going to be reporting because you're not providing CDI surveillance. It also lets Health Insight as well as the NCC know this as well. So we don't think that you're just forgetting to do that. It was purposely done. So that's basically all the steps are for monthly reporting plan. Now the next step is event reporting. And again, if you have an event to report, you will follow these steps. Otherwise, if you do not have an event to report for that month, you're going to skip this step and just go straight to the summary data report that we're going to review last. But for now, let's go through the event reporting steps. This form may look familiar to you. You may have seen it. This is the form we suggest completing if you don't already have a system in place. Some facilities have a system in place where they can easily gather the information that's needed for the reporting, and so they don't use a form. Some facilities like to use a form because the questions on this form are identical to what you'll be reporting on the electronic version. And so the link to this form is located here. You will also see the link when you get your handout. You can click on the link here as well as on the resource page. That's the very last, it's like the last page or second to last page of the handout. So to create an event, or add an event I should say, you go to event and then select add. And then you're going to be directed to this page here, and it's going to have these questions. It's longer than this. We'll go through a little bit more of this, but this is kind of the beginning of it. The facility ID will be defaulted, so it will already be in there. Resident ID is something you will have to create because that's something that the facility doesn't identify default to. And so a lot of facilities use their the resident's medical record number, so you can do that if you want. It's just to help easily track in the future if they wanted to do a search and find all the events they reported for a certain resident. They can easily remember what it was because the medical record number was there. And be sure when you're going through this, filling out everything that has a red asterisk. The last name, middle name, ethnicity, and a few areas that don't have the red asterisk are optional, but some facilities prefer to do that because it just makes it easier for them to identify the resident when they are doing a search and they want to look back at this information. Because there are multiple ways you can search for. You can search by name, you can search by date, resident ID, a few other ways as well, if you want to go back and look at an event. Here's a little bit more of the event reporting form, what it looks like. These are other questions. You just kind of scroll below, and this is kind of what you'll see right here. And these are pretty much all defaulted except for location. That's depending on what you set for your location. But these questions here are defaulted to, well, not defaulted, you'll have to enter them in, but they're always the same. They won't change as far as organism type, digestive system, stool specimen. Those are always going to be the same. Specimen date collection, you're going to enter there. Select the event type, it's always lab ID option. And so as I mentioned earlier about the acute care, there's going to be a question below asking if the resident came from an acute care setting, and that's based on if before they were admitted to your facility, do they come from an acute care setting? That could be a hospital, an acute care hospital, long-term care acute setting. So that's basically what it's asking for. If the resident had transferred temporarily for like a day to a hospital and they came back within the same day, that's not considered, that's not, that wouldn't apply. And also a very important thing, once you have completed the event report, make sure you save it. And once you've saved it, you'll get a confirmation that will confirm that it was created successfully with an event ID number. You can save the event ID number if you would like to track it in the future if you're looking for a specific event. Otherwise, like I said, there's other ways you can find events. You don't have to track this. It's just for your records if you want. So that's all there is for event reporting. Summary data report is the last step to completing your reporting. And this is a form that's another optional form you can use. And it's just to track your number of residents, number of admissions, number of admissions on C. difficile treatment. Really, the main thing that we're looking for are just the totals here. So the totals in these three columns. Not these do not apply, these middle columns for UTI. It's just the C. difficile questions we're looking for. And the link is right here that you can access, also available on the resource page. And as I mentioned earlier, the totals are all we're looking for. So if you don't have to use this form to track, if you have another way of tracking and getting this information, you're welcome to use that method. So to do summary data reports, you're going to go to the summary data section, select add, and then you will see the add summary data page and enter in the month and the year that you're planning to report the summary data. You'll be directed to this page here. And again, there's other modules in there you're going to ignore. They do not apply to this cohort project. It's only the MDRO and CDI Lab ID event reporting section that you're going to report for. And here's where you enter in the totals that I just reviewed. It's resident admissions here, resident days, total number of admissions on C. difficile treatment. If you don't have any, just put 0. So that's that section here. If you go a little bit more to the right here, you'll see other infection types, MDRO infections, and you're going to ignore all of them except for C. difficile. This is the only one you're going to work on. And there's 2 check boxes here. The first one is Lab ID event all specimens. That's that row. And this box will always be checked. And that's just to verify that you're providing surveillance for all of the specimens. This checkbox is only selected if you do not have any events to report. This lets the system know not to expect any events reported for this month because you've identified that there are no events. And so if you do not have any events to report, always check this box, or else you'll get an alert later on saying that you need to go back and fix it. And but if you do have an event to report, you will leave that checkbox blank, and then you report your event, so it will recognize that. And then just go and save once you're done entering in this section here. And this is kind of what I just reviewed, enter in your totals, and then you check the box here if you have no events to report. And so we're done with summary data reporting. So now you're done with your reporting after you've done all 2 to 3 sections, depending on whether you have an event or not. And so now the alerts I just kind of mentioned, you will, if there are any incomplete or missing events or summaries, then you will be notified when you log in. Every time you log in, you'll get a notification. Otherwise, it would say you have no alerts. In this case, there are 4 types of alerts. There's missing alerts, missing events, incomplete events, missing summaries, incomplete summaries. And as you can see in this sample here, there's at least one of each in each section. So for example purposes, we're going to go to the 2 incomplete summaries. So you click on that number link, and it will take you to the page that lists all of them, how many you have, whatever they are, you will see them all listed here, and select the summary ID number link. And in this case, we're going to go select the top one. And it takes you back to the summary data page. And so in this case, what happened was the user forgot to select no reports, report no events, and they did not provide an event report. So that made an alert for the event report, and that also made an alert for the summary data. And so if the person had an event, they would have to go in and report the event, and that would resolve that event as well as this alert. In this case, since they had no events to report, they select the checkbox, and then that removes the alert for the event. missing, and that also removes the alert for incomplete summary. So hopefully that made some sense to you. You can always reach out to any of the contacts here. My name is Lisa Barton. I'm the primary NHSN contact. Any other issues, you will contact your state lead. So there's our email addresses, and hopefully this training really helped you with reporting.